Hey guys, Dr. Matt here. Today I'm going to be answering some questions from you guys that I've gotten on Instagram or on our YouTube channel. So I'm going to go some random questions. So I'll try to answer them as best as I can. So let's get to it. All right, first question. So what are some exercises for lateral patellar tracking? So first off, what does that mean? So your patellar or your kneecap, when you flex and extend your knee, it slides up and down along that groove. So if there's some lateral patellar tracking going on, maybe that patella is shifted to the outside of the knee a little bit and it's not going through that groove as smoothly as it should be or can be. So from a PT standpoint, we're looking at a bunch of things. You're looking above and below the joint. The knee itself is a fairly simple joint. It's like a door, a hinge on a door rather. So it just flexes and extends or opens and closes. But there's so much mobility at the hip, there's so much mobility at the ankle, where if there's a weakness there or there's a mobility deficit there, sometimes the knee can feel the brunt of it, and that can exacerbate some of these symptoms at that kneecap. So, in a PT evaluation, I'm looking at glute strength, looking at hip mobility in the hip flexors and the piriformis, all those internal and external rotators. Just to make sure that when you're moving, when you're doing squats or lunges or deadlifts, whatever the movement might be, that you're moving as efficient as possible and not putting added stress onto the knee. So obviously a PT evaluation kind of gives a better understanding of what needs to be worked on to help with that lateral patellar tracking. All right, question 2. So can we fix hunchback? So first of all, what does that mean? A hunchback is more that rounded shoulder posture, maybe a forward head posture. So it kind of puts you into this, like an increased kyphosis in that thoracic spine or that mid-back region. So with that, a lot of the structures in the front become tight because they're in a shortened position. And a lot of the muscles in the back become weak because they're in a lengthened position. So what we want to do is the opposite when it comes to exercises. We want to open up that area and stretch out the structures in the front, and we want to strengthen the back muscles. So a lot of back strengthening, we're looking at a lot of the scapular stability. So you want to be the rotator cuff strength, the lower trap strength. Your head's in that forward posture. So a lot of the upper cervical muscles become weakened. So some upper cervical strengthening can help that with that as well as stretching out the pecs, both the pec major, the pec minor, the anterior deltoid here. So a lot of those muscles in the front, we want to open up and get into an extended position if you're always in that flexed position. And just to take it one step further, you want to make sure that maybe that your work environment puts you in optimal positioning too, and you're taking breaks throughout the day, just so you're not staying in this flexed posture for 4, 5, 6+ hours a day. So what you're doing outside of the gym or outside PT is just as important as what you're doing while you're in PT. All right, question 3. So a 12-year-old complaining of back and knee pain, what can I do? So first off, anytime a 12-year-old's in pain with exercise or with activities outside of, their sport or whatever they might be doing, it really shouldn't be the case. You really shouldn't be getting any pain following activity. So we need to ask ourselves, all right, what's going on? Is there a muscle imbalance going on that, maybe there's overdoing it at their sport, whether, if they're running a lot and maybe they don't have the strength in the lower extremity to handle that constant demand? Is that placing more stress on the back and on the knee? When it comes to a 12-year-old, I'm not really worried about how heavy they're lifting, but I'm more so focused on how is the quality of their movements. How is their squat form? How is their hip hinge? How is their lunge mechanics? Do they know how to engage their core muscles? How is their posture throughout the day? Are they wearing a backpack and they're staying like this as they're holding that backpack? So it's more so focusing on the quality of movements and just maybe introducing them to exercises that they'll see in the gym, and they can progress with the weights as they grow. But anytime you see a 12-year-old with back pain or knee pain, I definitely suggest getting them into physical therapy just so that they can work on the quality of those movements. Question 4. So this one's a little bit of a curveball. So I'm a physical therapist. What work clothes do you wear? So when it comes to PT, obviously we want to look professional, but I also need clothes where I can show patients exercises and not feel restricted. So I found Cuts clothing, and it's all I wear. Simple design, it looks professional, and more importantly, I can show patients exercises and not feel constricted while I'm doing that. So that's my go-to. Question 5. So I have right shoulder weakness. I have difficulty raising the arm overhead, and they work at a wine bar where they're doing a lot of that movement. So during the PT evaluation, this is actually a question I ask all the time: is what do you do for a living? Because that's going to kind of dictate some of the movements we need to look at and improve on, just because you're performing them repetitively every single day. But when it comes to the shoulder, it's a very tricky joint. You know, it's known for its mobility, but because of that, it's not really necessarily known for its stability. So, you know, there's the glenohumeral joint, but there's also your scapulothoracic joint, your acromioclavicular joint, your sternoclavicular joint, and they all play a role, at least with, you know, when you're raising your arm overhead. So first thing I'm looking at is usually thoracic mobility, you know, in that mid-back region. Is there any tightness or any restrictions just that's maybe causing some lack of mobility at the shoulder? And that's because for every 2 degrees you get from your glenohumeral joint right here, you're getting 1 degree of motion from your scapulothoracic joint, which is right in that thoracic region there. So maybe if there's some tightness in that mid-back area, it's preventing how smoothly you upwardly and downwardly rotate at the shoulder blade. So thoracic mobility is a big one. But on top of that, we're looking at a lot of the scapular stabilizers. You gotta figure there's 17 muscles that attach to the shoulder blade. So there's a lot of things that can maybe go wrong along the way, and that need to be assessed. So a lot of the smaller muscles, the lower traps, the serratus anterior, the rotator cuff musculature, some of those smaller muscles get overpowered by the bigger muscles, and that can prevent some of that motion as well. So I think looking at those smaller stabilizers and just making sure that everything's working together to make that overhead movement more efficient. Last question: how to deal with multiple injuries leading to pain and instability with exercises. So when it comes to this, and there's multiple things going on, I think it's where you're going for physical therapy is going to play a huge role. You want to go somewhere where maybe it's one-on-one and they're able to assess the entire body as a whole and not just focus on one area. Just because you're having, let's say, pain at the knee, it doesn't mean that that's the cause of the pain. So it could be coming from the hip, the ankle, the lower back, you know, depending on what you do for a living or what activities you do and what sports you play. All these movements or all these activities require full body movements. And if you're having multiple joints affected, you know, maybe one thing is just throwing out the entire kinetic chain and it's kind of having like a domino effect. So I think going somewhere where you're able to get one-on-one care and a program that's personalized to you, I think that's the key when it comes to something like this, where you are seeing multiple injuries maybe accumulating over the years. So invest in your health and get the right physical therapist for you. All right, so that was the first Q&A. We'll definitely do some more of these down the road. So if you have any questions you want answered, comment below, or you can shoot me a message on Instagram at dr.matt.barl, and I'll answer as many as possible. But I hope you found it helpful, and talk to you guys soon.